Hello and welcome to other video of Time for Healthy, and today we are looking at the symptoms and ways of prevention of cholera. So on our previous video we're looking at the cause of cholera and we talked about the Vibrio cholerae. So let's get going with symptoms. Let's start with the symptoms as of today. So when you look at the symptoms of cholera, they range from mild to severe, usually appear with a few days of infection. So these are the symptoms that you are going to see after a few days of being infected with cholera. So common symptoms will include watery diarrhea, profuse, rapid onset of diarrhea that resembles rice water and can lead to severe dehydration. So let's look at symptoms as we go. We look at a person vomiting. Individual may experience vomiting, which may contribute to fluid loss and dehydration. This is whereby you'll be having severe vomiting happening from period all over during the day. Then we have dehydration. Rapid loss of fluids from the body can lead to dehydration, whereby you have lack of water and lack of causing symptoms such as sunken eyes. This is another way in which we can see that you now experience dehydration. We can also have dry mouth and throat, whereby the throat will be very dry, and reduced urine output. You are likely going to have less urine output. You may go to the toilet, but you don't actually release that much normal urine, and also have low blood pressure. These are all symptoms of dehydration. Also dizziness, nausea, abdominal cramps, headache, diarrhea, and fever. All symptoms of cholera. Then we have also muscle cramps. Severe dehydration can result in muscle cramps and weakness. You will feel it once you in that certain period that we are talking about, in the few days of being infected, you actually get to have muscle cramps. So you have to look at how muscle cramps. The risk factors of muscle cramps can include muscle fatigue and heat, hot and humid condition. They also have dehydration can also be an issue. That's another issue that can cause muscle cramps, and poor condition. This all contribute to muscle cramp. Then we have the summary that we have here. So it's important that you to note that some individuals are infected with the Vibrio cholerae may not exhibit symptoms, but can still contribute to the spread of the disease, which means some individuals may not exhibit the symptoms, but they can still be contaminated with the disease. And also we look at the idea that you should promote prompt medical attention in rehydration therapy, are crucial for managing cholera cases, because you need to know how to address the symptoms once they get to your body, and especially to prevent severe dehydration and complications, because the issue is that you will not be educated enough to know that once these symptoms are you're now expressing feeling these symptoms and they are now showcasing on your body, they are likely going to see. So if you don't have the information without seeking medical attention and rehydration therapy on time, you're likely going to have problems. So we are looking at the idea that if cholera is suspected, seeking medical care immediately is essential for proper diagnosis and treatment, because you will be treated earlier than you going to be treated the cholera late. It might be too late that you might end up being cured by the cholera. So you need to be able to seek treatment early once the symptoms are now showing. The symptoms that I've been discussing, that I've been telling you and showing you pictures, that are symptoms that you are supposed to see. And not that I'm likely going to be a cholera patient, then you will seek medical attention. So thank you.